So this is a great opportunity for us to have a very full, thorough discussion on all the matters that have to do with both healthcare, but specifically plastic surgery, more specifically cosmetic plastic surgery issues across the U.S., particularly in California. Ms. Sara Azari is a criminal trial lawyer, both at the state and federal level. She represents healthcare professionals and doctors, both in the courts as well as protecting their licensing and other issues before state medical boards. And she's here to join us today and really shed some light on the legalities and what you as a patient need to do to protect yourself, both legally and even morally and ethically, in your search to look more beautiful or be healthier. So welcome, Sara.
Thank you so much, Dr. Ghavami. Thanks for having me.
Of course.
Yeah, this has been obviously all over the news lately because there's been so many tragedies of people trying to get a little lift, in their seat or in their breast, and then suddenly they're dead. And it's because they've gone in and thinking that they're going to a cosmetic surgeon. And when it's too late and they're disabled or blinded or dead, they later find out that this was not a board-certified plastic surgeon. So I think before I get into the legalities, I think you're probably best suited to talk about the importance of certification and what's the difference between a board-certified plastic surgeon and one who is just calling himself a cosmetic surgeon.
Well, the real difference is that with a board-certified plastic surgeon, you can only call yourself legitimately a plastic surgeon if you've done 4 years of medical school in the U.S., and now we're talking U.S. only. I don't know about laws. We don't know about laws in other countries. But in the United States and in states that have licensing boards like California, you cannot practice plastic surgery in a hospital or in a university hospital or in any setting outside of a surgery center unless you have board certification in plastic surgery, which means at the bare minimum, you have to have 4 years of medical school training by an accredited medical school in the U.S. Beyond that, you have to have at least 5 years or more training by an accredited residency training program in plastic and reconstructive surgery. Beyond that, it's the consumer's essentially burden looking through the wild west of medicine and Instagram and social media and websites to discern, is this person calling themselves a cosmetic surgeon? Did they do all this training or not? Because I can tell you, it's not easy training. I've done 40, 50-hour shifts. I've done trauma burn surgery. I've done full-on aesthetic surgery.
And don't you have to have a continuing education, meaning, every so often you have to have additional seminars and conferences that you attend to sort of bring you up to speed, much like lawyers or other professionals. And I think it's very deceiving for the consumer, for the patient, who is just dying to get that whatever job on whatever part of their body, and they go, oh, this guy's really cheap. And one of the messages I always tell, I tell clients who come to me and also the consumers out there who are going to be watching this, is that if the price is too good to be true, then it's too good to be true. It's not, there's something wrong with it. It's a red flag. And I just think that, one of the things that people need to be careful with is that any doctor, like you said, Dr. Ghavami, any doctor can perform plastic surgery, and certainly in the U.S., you don't have to have some special certification to perform plastic surgery, but look what happens when you don't. This is the result, as we've seen in the news over and over and over again. But what I want your viewers to know is that they still have recourse, okay? If you've been a victim of botched plastic surgery, or if unfortunately one of your friends or family members has passed away because of complications of botched plastic surgery, there's things that you can do. And the number one thing that you can and should do is to file a complaint with your state medical board, because that's where the whole investigation will begin. And trust me, that the medical boards are their job is to make sure that the public welfare is protected, the public health is protected. They don't care about the doctor making a living from the practice of medicine. So they have no problem coming in and doing whatever they need to do to yank that license if they think the doctor's not safe. And so even though that technically there's no law prohibiting any MD from performing the plastic surgery. You still have to, when you go before a board and they're looking at your conduct, they're going to look at whether you met the bare minimum standard of care for that particular procedure that you performed. And one of the number one ways the doctors go down in this particular area of plastic surgery is they falsely advertise themselves. So they'll either blatantly say that they're, board certified plastic surgeons, but more commonly what they'll say is that in the consultation, they sort of give the impression like they know more than they do. They have more training than they really do. And if you do that with a patient and the patient relies on that in getting their procedure done, you're in really big trouble. Not only that, but the medical boards will then refer to the law enforcement agencies and also the local DA's office for prosecution of the doctor. That's law enforcement and prosecutors sending a loud message to the public and to doctors that we're taking this really seriously. You can end up in jail, you can get fined, and you can say bye-bye to your license. So I don't want your viewers to think that they're left with no recourse, that, once they're trapped into that hole, unfortunate hole, that there's no way out. I think that you can, there's a lot of things that I think we're going to talk about that are preventative, but if, God forbid, you have been a victim of this, file a complaint with the medical board. It is absolutely actionable. They take these things very, very seriously. And also, look into filing a civil lawsuit for malpractice, because that's always a recourse for money damages.